On May 22nd, the World Health Organization will meet in Geneva to discuss how to best respond to future pandemics. Among the ideas is a U.S. proposed amendment to improve ways of detecting, reporting, and responding to public health events worldwide. Some social media users are referring to this as a pandemic treaty and are using the hashtag #StopTheTreaty to voice their opposition to the amendment. On a podcast hosted by Steve Bannon, former Minnesota Representative Michelle Bachmann claimed the amendment could give the WHO control over the United States. Several Verify viewers emailed us to ask about these claims. So let's verify. Would the pandemic treaty give the WHO control over governments during a global health crisis? Our sources are the International Health Regulations, proposed amendments to the regulations, and the WHO. The International Health Regulations are part of an international law that outlines the responsibilities of WHO member countries, like the U.S., when there's a public health emergency. It requires that countries report what's happening and that the WHO offer assistance. Earlier this year, the U.S. proposed several amendments to the regulations based on what we learned during the COVID-19 pandemic. They include adding early warning criteria, a request to provide genetic sequence data, and outlines a time frame for when and how countries can ask the WHO for support. It does not give the WHO authority over member countries. The amendment repeatedly states that countries can reject the WHO's assistance. So, no, the pandemic treaty would not give the WHO control over governments during a global health crisis. It doesn't give the agency any new authority and only outlines how they can help at the request of a member country. With your Verify, I'm Brandon Lewis.